Good morning, Representative Lippert.
Morning, Madam Chair.
Would you like to introduce yourself and actually, for the record, and then we'll have someone move your bill? Actually, I will move your bill, House File 1414, before the Education Policy Committee with the intent to lay it over. Go ahead, Representative Lippert.
Thank you, Madam Chair. Members of the committee, I'm Representative Todd Lippert, and I'm pleased to be presenting this bill that will task the Commissioner of Education to identify one or more model comprehensive sexual health programs for public school students in Minnesota. This bill is about the health and safety of our youth. Our young people deserve instruction that is medically accurate and developmentally appropriate in regards to human anatomy, reproduction, and sexual development. But it is also time for us to teach a culture of consent and bodily autonomy, giving our youth the tools they need to be treating themselves and others with respect, giving our youth the tools they need to be building healthier relationships and, in time, healthier families. It is also time that we recognize in school curriculum that our youth and their families are diverse when it comes to sexual identity. There are youth in classrooms all across our state, bright, talented young people whose families love them and are very proud of them, who identify as gay, lesbian, bisexual, or transgender. These youth deserve a sexual health curriculum that acknowledges that they exist and that will provide them with information that will help them live healthier, safer lives in relationship with others. A comprehensive sexual health program is inclusive. Abstinence will be a part of the curriculum, and so will accurate, developmentally appropriate information about contraceptive use. Research consistently shows that a comprehensive approach to sex education does a better job of reducing unintended pregnancies and delaying sexual activity than abstinence-only approaches alone. Not surprisingly, young people are also more likely to use contraceptives effectively when they are taught what they are and how to use them. It's important to say here, too, that local districts and parents are still in the driver's seat. If local districts don't feel that this model comprehensive sexual health program is a good fit, they can opt out. There are families who opt out of sex education now in public schools, and families will still have that option if the model program isn't a good fit for them. In my other work, I'm an ordained minister in the United Church of Christ. I've been an ordained minister for 16 years. Our denomination developed a comprehensive sexual health curriculum along with the Unitarian Universalist denomination. And this curriculum is highly regarded by experts in this field. My congregation is one of many UCC churches that offers this curriculum. We offer it because we care about the health and safety of our youth, and we value the outcomes of this curriculum and program. Delayed sexual behavior, fewer unintended pregnancies, entering into relationship with mutual respect. We offer it because parents, and not just the parents in our church, but parents who find out about this program in our community, are asking for it for their children. As a representative, I serve a district with two colleges, Carleton College and St. Olaf College, and I spent a lot of time talking with college students through the course of the campaign. Consistently, they talked with me about their concerns for GLBTQ equity and the high rates of suicide attempts and completed suicide among LGBTQ youth. A sexual health curriculum that acknowledges the identity of the GLBTQ community and their relationships will be a significant step forward in reducing the shame that many in the GLBTQ community feel, and a step forward for health for all of our youth. College students also talk with me consistently about their concerns about sexual violence and gender equity. If we are serious about addressing sexual violence in the state of Minnesota, then we need to go upstream and have conversations with young people, the conversations that are needed to create a healthy culture of consent. Finally, I have 3 children. My oldest daughter, Clara, is 15. About a year and a half ago, she's a reader. About a year and a half ago, she started reading books about sexual violence. You know your daughter's growing up when she starts digging into a topic like this. And this year, she participated in Youth in Government through the YMCA program. And she presented a bill to the freshman and sophomore House of Representatives. And her bill called on the Department of Education to teach consent in middle school and high school. And her bill was approved unanimously. Our young leaders already know what's needed. They already know where we need to go. And it's time for us to lead too. With that, I'll turn the testimony over to a young person, Grace Muth, who's here to testify.
Thank you, Representative Lippert. Please approach the testifier's table and state your name for the record and proceed. Thank you for being here today.
Thank you, Madam Chair. My name is Grace Muth. I'm a student at Northfield High School. Consent, identity, and health. These are some of the most important pieces of having a healthy relationship. I have firsthand experience with just how important each of these undereducated topics can be. As a part of my 8th grade year, I participated in the Our Whole Lives program through my church. This program was an inclusive, comprehensive sexual education program that not only taught me extensively about sexual identity, but covered consent in a way that I have never seen in a school health class. I have both benefited from a more inclusive, comprehensive curriculum and suffered because of the shortcomings of the current curriculum. There are 2 anecdotes that I would like to share that show this. The first anecdote is from my required 10th grade health class. In this class, we had a unit covering sexual health and identity. However, as a part of this unit, we barely covered consent. The teacher mentioned that it should be explicit, both people should agree before anything happens, and not much else. When we reached, in addition to failing to cover consent sufficiently during this unit, when we reached the sexual identity section, all the education we received on the subject were the definitions of the terms gender identity and sexual orientation. Beyond that, I was the one who explained to my classmates what sexual identity was. The only reason my health class was educated about sexual identity was because I had learned it 2 years prior in the Our Whole Lives program. Another piece that was missing from this class was in-depth education about sexual health. The main way we were educated about sexual health was using fear tactics instead of information that could actually be useful. The biggest example of this was the fact that we were taught about STIs by being shown the worst case scenario of each infection instead of ways that we could be safe or get treatment. The second anecdote, an experience I had to do with a lack of consent education in our school system. Consent, through the Our Whole Lives program, was taught to me using the metaphor of a cup of tea. Consent is like a cup of tea, and sometimes people want tea, sometimes they don't, and sometimes they change their mind about wanting tea. But you should never force someone to drink tea. The lack of consent education in current health programs became very apparent to me through the experience I am about to share. I feel confident that I can speak for many of my classmates when I say that I have already had a relationship in which consent was not clear between both people and there was a lack of mutual respect. This left me emotionally damaged, and I can't help but wonder how improved consent and intimate relationship education would have changed my experience and could potentially prevent it for my classmates. If we are going to attempt to teach healthy relationships and hope that sexual violence ends in our society, we need to start by teaching consent in a better way, as well as improving the way we teach sexual health and identity to be more inclusive in a world that desperately needs acceptance and openness. Thank you.
Thank you, Ms. Muth. Thank you for being here. Representative Lippert, do you want to call up your next testifier?
Thank you, Madam Chair.
Please state your name for the record and proceed.
Thank you, Madam Chair. My name is Kevin Brown, and I currently serve as Associate Conference Minister for Faith Formation with the Minnesota Conference United Church of Christ. In this role and in previous roles as a congregational pastor and faith formation leader, I've had the privilege to work with communities and families both in the Twin Cities and throughout Minnesota. In these roles, I've had a chance for the past 12 years to help implement, facilitate, and coordinate the Our Whole Lives program, the secular comprehensive lifespan sexuality education program that Representative Lippert and Grace spoke about moments ago. The commitment on the part of our congregations to this work grew out of countless conversations with parents deeply concerned about the lack of access to comprehensive sexuality education for their children in public school settings. These parents desperately want their children to have access to comprehensive, medically accurate sexuality education. They long for their youth to be provided knowledge about human sexuality, equipped to make healthy and responsible choices regarding their sexual behavior, affirmed with dignity and respect regardless of their sexual orientation, gender identity, or gender expression, and prepared for healthy and developmentally appropriate relationships that are rooted in ongoing consent, mutual respect, and open communication. These parents have also been eager for programs and opportunities that foster conversations between parents and children and encourage adolescents to seek out trusted adults, parents, teachers, counselors, faith leaders, with questions and for support. After 12 years of working to implement Our Whole Lives in a variety of community contexts for elementary, middle school, and high school age groups, I continue to be astounded by the experiences of the children, youth, and parents who have been part of these programs. Two stories in particular stand out. Just last month, a high school senior from northwestern Minnesota shared that she had never received any sexuality education in her public school setting, ever. She was overwhelmed with emotion as she expressed dismay that no one had found it important enough or cared enough for her well-being and her full development to share important information or provide a space for her to ask the myriad questions that she had had throughout her growing years. A second story that I remember is several years ago when a high school age girl came to me and another facilitator after one of our sessions. She wanted to let us know that she was bisexual and had never felt safe enough to share this with anyone before. That night had been the first time she had ever heard an adult say that being straight or gay or bi were all part of the natural range of human sexual experience. This was the first time she had ever been affirmed, had ever felt normal, accepted for who she was. She went on to tearfully share the experience of some of her peers in similar places, whose shame and isolation for their identity had led them to places of contemplating self-harm and suicide. As a society, we have to do better. Our children deserve to be affirmed, respected, provided accurate information about their growing and changing bodies and identities, and equipped to make developmentally appropriate and healthy decisions regarding their relationships and their lives. The trusted adults in their lives need to be prepared to support their growth and development and to help them navigate the hypersexualized and confusing media culture in which they live. I urge you to support this bill. It can quite literally save the lives of our children. Thank you.
Thank you. Next testifier.
Thank you, Madam Chair. I don't know who exactly is next. Jump on in.
Could you please state your name for the record and proceed?
Thank you, Madam Chair and members of the committee. I am Lindsay Bryce. I'm the Law and Policy Director for the Minnesota Coalition Against Sexual Assault. And I've worked with and for survivors of gender-based violence for over 20 years. MNCASA is a statewide coalition of 75, actually more than 75 member programs, allies, and survivors. We currently fund 6 programs to do sexual violence prevention work. All of these programs focus on exactly what we're talking about here today. All of them focus on educating youth about healthy relationships, consent, and the prevention of sexual violence in their communities. I'm here today, and MNCASA is here today to support House File 1414 and to thank both Representative Lippert, co-authors, and this committee for advancing this important conversation. Comprehensive sex education includes a wide range of topics, and you've heard from several people, perhaps most eloquently from the youngest member I've heard speak today, the youngest testifier I've heard speak today. It includes a wide range of topics such as healthy relationships, communication skills, consent, and setting and respecting boundaries. All of these topics help youth develop practical skills so they can make the best choices for themselves, and empowers them to create healthy relationships that uphold their own values and boundaries, and it teaches them to respect other people's boundaries. The more understanding we have of our bodies and of sexual health, the easier it is to make healthier choices and to be ready and comfortable consenting or not consenting to a whole range of activities. And a big piece of comprehensive sex education is consent. Consent education and consent skill development is crucial for preventing sexual violence. The Center for Disease Control defines teaching skills such as consent, healthy relationships, healthy sexuality, and empowerment as a best practice for sexual violence prevention. The earlier youth develop these skills, the more likely that knowledge and that skill building continues throughout their lives and within all their relationships. So providing comprehensive sex education within schools is the most efficient and effective way to reach youth. We also need this education to be consistent statewide so that youth are receiving the same messages around and knowledge of healthy relationship skills. Comprehensive sex education provides youth with the necessary tools to succeed and have safe, healthy, and consenting relationships of all kind. And I appreciate this committee's attention to this issue.
Thank you. And next testifier. Excuse me, Representative. We'll have the testifiers will be staying around for questions. We're going to let the author present his case first. Thank you.
Chair Uwackum and members of the committee, I want to thank you for this opportunity to speak on behalf of statewide comprehensive sex education. My name is Nicole Chasen, and I live right here in St. Paul, Minnesota. Like a good family physician, I wear many hats. I'm a healthcare provider practicing in a culturally diverse neighborhood in South Minneapolis at Smiley's Clinic, where I'm also a faculty at a family medicine residency training program. My curricular focus is on reproductive health and adolescent health and wellness. For the past 10 years, I have been the medical director of the Minneapolis School-Based Clinics, a collection of primary care clinics run by the city of Minneapolis and based in all of the public high schools. And I'm also an active board member on the Minnesota School-Based Health Center Alliance. During the past decade, I've been a certified Our Whole Lives instructor, teaching 5th and 6th graders about healthy sexual development at McAllister Plymouth United Church. And most importantly, I'm the mother of 2 sons who have attended St. Paul Public Schools and were part of the OWL curriculum at our church. And I did drag my youngest of those 2 sons with me here tonight to witness this. In the school-based clinics, we serve approximately 3,000 students annually in our clinics for a variety of healthcare needs, including mental health, basic preventive care, and reproductive health care. We also provide health outreach and education to closer to 9,000 students throughout classroom education, lunch chats, and health fairs. Students always have a lot of questions about staying healthy in all aspects of their lives. And some of our outreach is focused on healthy relationships and debunking sexual health myths to help them learn how to be better advocates for their own well-being. Our popular grant-funded STI testing days often bring in between 80 to 100 students at each site for the one day that we do urine screening and a conversation with our health educators about prevention. I tell you this because our youth are seeking information, but not all school systems have school-based clinics available to them or this kind of school-based health outreach. Sexuality is a basic part of who we are. It is something that should be embraced as a normal part of human behavior. It's true, sexual activity does have consequences. While the teen birth rate has declined steadily over the past few decades, the United States still has the highest teen birth rate in the industrialized world. Without social supports in place to ensure completing an education or to provide access to affordable childcare, teen pregnancy continues to be a marker for structural inequalities that can lead to generational poverty or disadvantage. Adolescents are also disproportionately affected by sexually transmitted infections, typically accounting for nearly half of all new STI diagnoses annually. These infections can have lifelong health effects. But as you've heard, comprehensive sex education is not just about abstinence, contraception, and condoms. It's about understanding more than just the biology of sex. By covering the emotional and social aspects of sexuality, it also teaches about healthy relationships, learning how to communicate with others, and exploring how to make healthy decisions. It's about learning how to recognize your own sexual identity and sense of self while also exploring bigger issues around consent, safety, and gender identity. It seeks to empower youth to make responsible choices that protect their health and well-being and can support parents by providing honest, accurate, and affirming information by helping break down stereotypes and incomplete information that may sometimes come from peers and the media. Think about your own sexual health education. Was it adequate? Lack of access to these bigger issues around identity, consent, and respect put us at risk for perpetuating power and control dynamics that currently exist. Talking about consent and relationships protects the safety of all genders, and ongoing conversations in this Me Too era help us all establish safe and respectful relationships. My own state representative, Representative Herr, recently sponsored a bill that would require high school students to take a personal finance course in order to graduate. And I fully support an effort to ensure that all students have the tools to succeed financially in their adult life. Shouldn't we also ensure that all of our students have the knowledge and tools to create and sustain healthy and happy, intimate relationships in their adult lives too? Comprehensive sexuality education will provide Minnesota youth with those lifelong skills. And I urge you to support House File 1414. Thank you.
Thank you, testifier. Do we have another testifier to join us?
Yes, we do, Madam Chair.
Thank you. Please state your name for the record, and then you may begin your testifying.
Good morning, committee members. Good morning, Chair. I'm Jenny Oliphant from the University of Minnesota's Prevention Research Center. Much of our work over the past 30 years has focused on effective approaches to teen pregnancy prevention, violence prevention, and ways of promoting resiliency and healthy development in our children. I'm a public health professional with expertise in health education and young people. I live in Minneapolis, and my children are ages 13 and 16. I live this topic on a daily basis. I would like to tell you what the literature tells us and what our research here at the University of Minnesota's Prevention Research Center has taught us. I speak for myself in that capacity as an expert. The first 2 points I want to make is, first, medically accurate, responsible sex education in schools is supported by the overwhelming majority of Minnesota parents, not just Minnesota adults. At our center, we completed a statewide survey of 1,600 parents of children and youth, sampled across 8 congressional districts, asking what parents would like to see taught in our public schools. as detailed in one of our scientific papers published in the Journal of Adolescent Health, Minnesota parents want children to receive encouragement to abstain from sex and to receive accurate information about birth control, family planning, condoms, prevention of pregnancy, and sexually transmitted infection. 90% or more of parents support this. And, excuse me, and this cross-cuts political orientation, religious preference, gender, education, and income level. It's unusual to see this level of concrete concurrence in a survey, and these results reflect the findings we see from parent surveys in other parts of our country as well. Secondly, I believe it's very important to answer the question that many here may have, and the question that we are asked most often when we speak to parents, legislators, and the media. How does medically accurate sex education affect our kids when schools use rigorously tested and evaluated curricula? What happens? This is what we know from the scientific research in Minnesota, the United States, and around the world. The impact of this kind of sex education includes delays in age of first intercourse, increased proper use of condoms and contraception among sexually active adolescents, fewer sexual partners over time, lower rates of pregnancy, abortion, and birth. Additionally, I'd like to speak to the health literacy that has been brought up by in other testimony. Our young people need to know how to take care of themselves in all forms. Health literacy is one of the ways that we can help change the health determinants of young people. So by providing this kind of education, we are not only just changing their sexual health knowledge, but we're bringing young people into the world with greater health literacy, a much needed aspect to their overall health. And as much as our wonderful physician community, nurse practitioner community, and other health providers do around this, in this topic, in most interactions with young people, less than 35 seconds in a medical visit are actually allotted to this. We cannot just rely on our medical providers to provide this information. We must start from an upstream approach, that is, in our schools. Thank you for this opportunity to be with you today, and I'm happy to answer any other questions that may arise.
Okay, thank you, Ms. Oliphant. I'll have you wait, and if we're going to have questions in a little bit here. Representative Lippert, do you have another testifier? Thank you. Please approach the table and introduce yourself and proceed.
Hi, my name is Grace Mortensen. I am speaking on behalf of Reaction for Action, which is a youth participatory action research group. We're funded by Youth Prize, and we are run through the Annex Teen Clinic of Robbinsdale. So our group of young people has spent the last year developing, distributing, and evaluating a survey for young people to share their experiences with sexual health education in the state of Minnesota. Our group surveyed just over 400 young people ages 13 to 24. We collected responses from across the state, starting in the metro area like Minneapolis, St. Paul, out to Stillwater, to Robbinsdale, and then to greater Minnesota in St. Cloud, Bemidji, Duluth. And so I believe distributed with you was an infographic of some of our research, as well as a research summary that'll be titled Annex Teen Clinic with that information there. So in our survey, one of the questions that we asked participants was, if you were talking to the people who were creating these standards, such as the lawmakers, school district officials, what would you suggest to them based on your experience in sexual health education? I would like to take my time here to share with you their experiences and their stories, and how their answers are directly related to Section 1, Subdivision 2B of HF 1414. I think that's right. I don't really read bills very often. So in regards, we had an overwhelming amount of students asking for education that was inclusive of consent, gender and sexuality, and healthy relationships. One person called for, quote, inclusion of trans, non-binary, intersex, and gender non-conforming people, as well as LGBTQ plus relationships. Teaching about consent and teaching all people about all anatomies. I only learned about female anatomy, end quote. Another person responded, recalling upon her education, saying, quote, my school altogether omitted conversation about the LGBTQ plus community and the different information they may need access to. Part of my curriculum in middle school was actually discouraging cohabitation until marriage. I felt this was not only unnecessary, but only included due to the teacher's beliefs. Because of this, I wish they were to include more information in the curriculum for the LGBTQ plus community and work harder to remove religious beliefs from sex ed classrooms. Another thing that was completely omitted was a discussion on consent. The word was never mentioned once, although I feel it should be required in every classroom, end quote. Other answers from young people also included consent, consent, consent. Consent needs to be a part of sex ed. Then we had consent in all caps. Then we had we need consent with 3 exclamation points. I think you get the point. Young people today care about bodily autonomy, they care about healthy relationships, and they care about consent. Some of our responses also asked legislators to teach birth control and STI education beyond abstinence only. I quote, the sexual health education I received was not only inadequate, but it also taught me that sex is something to be ashamed of unless used for procreation. I wish I had been taught to be comfortable with my sexuality and my body. I also completed the course thinking that the only viable option was abstinence. I had never heard of the many birth control options available until a doctor had to explain them to me in my 20s. Not only did my sexual health education not provide crucial information for making safe choices, but it also impacted my view on sexuality negatively. For LGBTQ plus folks, there was the point brought up that, quote, there needs to be more focus on the culture of consent and LGBTQ sexual safety, not only for gay men specifically in the prevention of AIDS and HIV, but also for lesbians and using things like dental dams, end quote. Reading response after response of this survey, one thing was clear. The young people we spoke to are frustrated with abstinence-only sex education. Quote, we need proper sexual health education because knowledge is power. If youth know and are informed, we can limit rape culture, decrease STI rates, have planned pregnancies, planned parenthoods, and protect our youth, end quote. So 66 of the students that we surveyed were not happy with their sexual health education classes. That was 66% of the students that we spoke with. If that isn't reason enough for the change that needs to be made for our young people, I'd like to shift to a more personal note. I began a career in health education and promotion because as a high school student, I was completely and consistently dissatisfied with my health education. I felt both our instructor and our curriculum were not considering students as our full selves. We looked at scare tactic photos of severe cases of STIs. I remember a friend who sat next to me at one point leaning over during our abstinence talk saying, this makes me feel so ashamed that I have had sex. I honestly wanted to walk out of the room right then. And when I told my mom that I wanted to work in community health education so that I could advocate for better sexual health education, she replied, well, why not become a health teacher? I had thought of that too, and a few weeks prior, I had gone to my health teacher after class and asked her, why aren't we getting comprehensive education? Why are you choosing to deny students an education that prepares us for lives in these bodies? And she said, it wasn't her choice. So I realized I couldn't become a health teacher because I would have to follow curriculum guidelines given to me by the state, decided by PTA boards, by parents, not by scientific and research-based evidence. So I decided then, in my 17-year-old self, that in order to advocate for comprehensive sexual health education, I had to work in my community. I had to support legislative advocacy that lifts voices like mine desperately wanting to be heard. I wanted to make sure that other kids didn't have to sit in bed watching YouTube videos about hymens, that other kids didn't have to sit in bed alone reading blog after blog about sexuality identities and gender identities because these spaces and these communities didn't exist. I want to make sure that no one else learns what sexual harassment is firsthand. What? Like, no. I'm so tired of all of these things that I really just want us to be able to create and cultivate conversations. And since those frustrating hours in my high school classroom, I've been striving to advocate for these environments of health education for youth that are honest, that are comprehensive, and that account for the different lives that we all are living. Young people know better than anyone else in this room about their experiences. They know what they need to improve their education. The young people of Minnesota want to learn about comprehensive health education, and this act of legislation is the first step in that process. So I ask you to please give them the resources and the opportunity to do so. Thank you.
Thank you, Ms. Mortensen. Representative Lippert, did you have any other testifiers, or should I continue with the list that's signed up?
So no other testifiers
Okay.
that I have. I do have 2 letters of support that I had hoped would make it into the packet, but they did not. I don't know
Okay.
how you would like me to.
Oh, yes,
handle
we'll
those.
have the page hand those out.
Okay.
And then
Can you
before,
make copies of these, maybe?
yes,
Okay.
yeah. And then Representative Lippert, if you want to kind of have any wrapping up comments right now before we go to other testifiers, and we'll let you also respond to those testifiers, and then we'll go to questions.
Sure. I think we've heard from multiple testifiers the importance of this comprehensive approach to sexual health. That it's going to be an improvement for the health and safety of our youth, that we need to have deep conversations about consent, to develop skills around consent if we want to be addressing many of the challenges that we're facing, that our youth deserve medically accurate information, that's a duty of the public school to provide. And so I look forward to the rest of this conversation with the committee today.
Thank you, and I think if you want to, we haven't really walked through the bill that much, so I'm going to have the other 2 testifiers that have signed up come up, and then maybe you can just quickly walk through the bill to actually state what's actually in there, because we've had a lot of information floating out, and I want people to understand what's actually in the bill. Grace Kelleher, did you want to come down? And then Fred Nolan afterwards. Please state your name for the record and proceed.
Good morning, members. My name is Grace Kelleher, and I represent the Minnesota School Board Association. And we're here to express some concerns about this bill. And I'd like to start by reminding you what is presently in law. Presently in law, it says the Department of Ed must adopt the recent Shape America, and that's the Society of Health and Physical Education, kindergarten through 12, standards and benchmarks, and for physical education as required physical academic standards. The department may modify and adapt the national standards to accommodate state interest. The department must make available sample assessments where school districts may use alternatives to local assessments to assess students' mastery of the standards beginning in 2018 and 19. So if those go into effect this year, I want to say that all school districts in Minnesota are required to identify standards, benchmarks, curriculum, and assessments in health education. All students must receive instruction in health education K through 8 or by district-determined grade bands. High school students must receive instruction in health education at least once. The Minnesota Department of Education recommends that districts utilize the National Health Education Standards. These standards establish, promote, and support health-enhancing behaviors for students in all grade levels K through 12. So those are a lot of words, but I'm interested in what does that mean locally? How do you move those forward? So there was a list of over 30 master teachers that put together the benchmarks and standards I discussed. So I decided to start in kindergarten. give an example of how that goes forward. And the national standard is students will comprehend concepts related to health promotion and disease prevention. In particular, the student will describe how individual behaviors affect individual health, including family life and sexuality. As an example of how to do that, they predict what happens when playing in safe and unsafe ways. They name examples of good touch and bad touch gestures. You going on, other things they bring in, once again, is identify cultural customs, explore how families are alike and different. So that gives you a feel of what kindergarten goes. They're 56 pages, so I promise you, didn't bring them all up here for you to look at today. Let's move on to first grade. So what does first grade look like? Students will demonstrate the ability to advocate for personal, family, and community health. They describe consequences of telling or not telling. Practice communication skills for getting help from trusted and safe adults. Use puppets to show and tell and yell when someone is not respecting personal body safety. So going on, I'm going to jump to 10th grade because let's see what we do there. Here we say we're looking for students to demonstrate the ability to practice health-enhancing behaviors and avoid and reduce health risks. Their benchmarks here and examples is that we record a stressful situation you have experienced and explain an assertive action that would have helped you cope with each situation. Here, teaching various stress reduction pieces. And last but not least, organize a classroom panel for teens to discuss date rape prevention. Invite a speaker to talk about physical, emotional, and sexual abuse teens face sometimes. Compare and contrast issues you face as a teen. Develop strategies for dating safety. Prepare a handout to distribute to the school. Research the causes and effect of binge drinking and develop emergency plans of action for potentially dangerous situations. That gives you an idea of what we presently have in place. We have some specific concerns in the bill and how they would interact together. Madam Chair, if you look on 1.16, consent, the bodily autonomy, health relationships, including relationships involving diverse sexual orientation and gender identities. There needs to be some definitions of what those include. Going down to 1.21, consent, affirmative, conscientious, voluntary agreement to engage in interpersonal, physical, and sexual activity. Our question comes as you go to the second page, where if you look at 2.6, we are supposed to respect community values and encourage students to communicate with parents. And number 2 below it, 2.9, to respond to culturally diverse individuals, families, and communities in an inclusive, respectful, and effective manner. And we are concerned with a number of cultures presented in a school environment. How do we show respect to everyone's approach to this issue? And they might be widely divergent in a classroom. The author was wise to include the statute that says that a parent can object and review the material themselves and offer an alternate education curriculum. Our concerns happen is if in fact this becomes a mandatory statewide curriculum, what if 50% of the parents opt out for an alternative? What does that look like? How does a locally elected school board deal when their communities have trouble accepting every piece of this new curriculum going forward? And last but not least, we are concerned about the teachers in this. They basically bring in that anyone can come in and teach. So think about our tiered licensure system. This doesn't say you can be a tier 1 teacher and come in and teach this curriculum. This basically says anybody can come in, and we do have a system in place that would allow this. Certainly that language is problematic. And last but not least, if you really want to perform a check on what the school districts are doing around the state and have actual data in front of you, I encourage you to think about asking the legislative auditor to look into this, or in fact, asking MDE to report on what this looks like around the state. With that, Madam Chair, I'll be happy to answer questions, and I appreciate the time.
Representative Lippert, would you want to talk about any of that, or should I bring the other testifier up?
Why don't we bring the other testifiers forward?
Sounds good. Fred Nolan, please.
Hello, I'm Fred Nolan, the Executive Director of the Minnesota Rural Education Association, representing 231 greater Minnesota school districts, educating 245,000 students today and every day. That's not a snow day.
We're trying to fix that, Mr. Nolan.
Yes, thank you, thank you. Well, you have more power than I expected. All right, we won't go there. MREA in our mission statement puts learners first, and this is the perspective I'm trying to come from, and I appreciate hearing from Grace Muth, your testifier today. Sexual health and safety are important aspects of young people and adults' health, safety, and well-being. We can all agree on that. I have no objections to MDE putting up model curriculums that address this. Many of our smaller districts have limited curriculum resources, and model curriculums may be useful. I do have some concerns about the way the list is currently described, but my main concerns are the implementation sections of Health File 1414, beginning with 2.14 and working through 2.14. And the context of my concerns are twofold. One, statutorily, health has no state standards by law. 120B.021 clearly states that health, for which locally developed academic standards apply. And academic standards actually direct the content and learning that students are supposed to have. Secondly, our member districts have had issues with MD approval for other programs which the legislature has approved, such as 4-day weeks, innovation zones, and the formula for American Education Indian Aid. MDE has taken excessive amounts of time and some ways essentially written regulations for which it has no authority. MD is aware of this, and in some cases made corrections. 1414 lists the information districts must submit to MDE, but not the criteria upon which MDE can make a decision, nor the timeliness with which those decisions should be made. And I mean no disrespect to MDE. You guys are under-resourced, and this is just one more thing to put on your plate. To replace this section, I'd ask that you consider a model the mandated assurances that school districts do not discriminate which school superintendents must annually certify to MDE. And there's a long list. I'm sure MDE can supply that to you. I can see an annual statement of assurances listing everything that's currently in 1.13 to 2.13 with some modifications, and then a question whether districts are using the model curriculum and which one. I believe this would meet the intent of House File 1414, be simple to administer for MDE and for the districts, and to preserve some degree that local determination that I mentioned at first. Think of that local determination statute in 120B.021. It's kind of a white line. And when are you walking across it, and how are you respecting that and still achieving the goals you're trying to achieve here? Superintendents ethically put their license on the line every year when they make these assurances of no discrimination. And so they be putting their license on the line if they said, yes, we do these topics in our curriculum. I also have a question regarding 2.28 to 2.32, which Grace Kelleher raised. If a district believes the best available person to teach somebody's health education is a local minister or priest, are you okay with this? Because that seems what you're saying. I think you're thinking that medical professionals, such as a nurse or doctor, would be the person to come in, but the language is broad. Thank you for this opportunity, Madam Chair, and I'll be available for questions.
Thank you so much, Mr. Nolan. I just have one quick question for you before I let Representative Lippert respond. Did I hear you right, say that there's no statewide curriculum set for, you had mentioned,
One,
there's no standard statewide by law for health?
Madam Chair, It is correct that 120B.021 clearly states that health for which locally developed academic standards apply, and I know that Representative Erickson was here when that was determined originally. It was part of the big discussion in the early 2000s about standards, and that has been the state law ever since. There are the shape recommendations, and I do believe the PE, there are standards, but the health has been locally determined for over 15 years.
Thank you, Mr. Nolan. That clears it up because I was a little confused with Ms. Kelleher when she came down and started walking through that. So thank you so much. Representative Lippert, would you like to make some comments or response to that?
Thank you, Madam Chair.
Thank you.
Yes, so I would be open to having some more conversation, both about the mandated assurances point that Mr. Nolan brought forward. I'd be interested in having more conversation about that. And as far as, and also having more conversation about the bringing in other experts from the community as well. There may be instances where a religious professional who has training in comprehensive sex ed is someone who's qualified in that local space. But I'd be interested in talking more about that language and making sure that it's as precise as we need it to be.
Thank you so much. And I think I'll first ask, I want to take about 10 minutes just to see if there's anybody else in the audience that would like to testify for or against this bill. I see one hand up. We proceed to the testifiers table and two. And state your name for the record, and the next person can be on deck. And then make sure you sign up with our page afterwards so he gets your name for the record.
Good morning.
All right.
Good morning, Chair and Committee. Thank you for letting me speak. My name is Annie Elmer. I've been living with HIV for over 28 years. In 2010, I attended an AIDS Action Day and heard a student share how his whole class had been taught abstinence only. And another student in the class asked about condoms, and the teacher stated that they're not effective. It's sad for me to think about all of the students that have been taught that misinformation year after year. My friend and I share our stories about living with HIV and AIDS to students at St. Louis Park High School. The teacher there has a box available for students to ask confidential questions. Many ask, what is the normal size of a penis? If they're not getting accurate information from parents or school, they will go to the internet, and sometimes they're getting that information from porn. In Forest Lake, we shared our stories with middle school students. One of the parents wouldn't allow her child to attend, and she told the teacher, you know how highly contagious it is. The teacher now sends home a questionnaire about AIDS to educate the parents. When I ask people, what are the 5 bodily fluids that can transmit HIV, most people do not know. How can we expect parents to teach their children if they don't have current, accurate information? Minnesota students deserve factual, clear information on how to have conversations about consent, how to prevent sexually transmitted infections, and other important information related to their sexual health to make healthy choices. Please pass this bill so that all Minnesota children have the knowledge to make wise choices and so that they don't end up living with HIV like I am. Thank you.
Thank you, Ms. Elmer. And I see someone else came up to testify. Please state your name for the record and proceed.
Hi, I'm Ash Konkar. I'm a freshman at Roseville Area High School. I identify as genderqueer, non-binary, panromantic, asexual. None of these things have ever been taught in any of my health classes. I realized that I could be non-binary when I met a couple of non-binary people at a summer camp that I went to. I have to email my teachers before every class to make sure that they know what genderqueer or non-binary is and to tell them my pronouns. My sex ed has been abstinence only. I have speakers come in because the teachers don't know the topic and they are not always informed about the topic. I had, last year, I slept through half the class, but when the speaker came in, when I was awake, I counted her on the second day, and she had over 70. She didn't know what she was talking about. She couldn't answer the questions that the kids put in the box for anonymous questions, and overall, it was just a lot of fear tactics and misinformation. We at GSA, we were talking about the lack of comprehensive sex education, and for those of you who don't know, that's the Gender Sexuality Alliance. And we had a list of things that are good or bad about the current sex education program. And out of all of them, there was one good thing. And it was a lot of things like the teachers don't teach us LGBTQ comprehensive education, or a lot of our friends don't know about things that would make sex easier for them because they're queer. And so I actually have a friend who didn't have access to information about LGBTQ identities, didn't realize that she was asexual and aromantic. She dated a guy for about a week. In that time, I was like, when can I go back to my elementary school to get the Great Body Shop work thing on abusive relationships? Because he was like, it's my right as your boyfriend to hold your hand. And she was like, no, thank you. So I feel like it's really important for kids to have comprehensive sex education, because otherwise they will turn to the internet, which is not always reliable, and they will have unsafe experiences, such as my friend. Thankfully, she did break up with him, but that was her choice.
Thank you for bringing your voice here to the table. Is there anyone else in the audience that wishes to testify? All right. Representative Lippert, would you like to say anything else before we go to questions?
Madam Chair, I could just walk through the bill.
Yes, that would be
in broad
fantastic.
strokes,
Thank you
if that
for
would be
reminding me.
helpful.
Yes, it would be very helpful to actually
Thank
find
you.
out what's in the bill.
Sure. So I think it's very important to state that this is asking the Commissioner of Education to develop a model program. And we've heard from testimony that there's a patchwork of with that throughout the state of what's really happening in sexual health curriculum across our state. And a model program could allow us as a state to focus, have something to point to that could bring more uniformity to schools as well. So I think that's very important to state. In subdivision 1, it talks about exactly what the model program would consist of and some of the content. So medically accurate instruction that is age and developmentally appropriate on human anatomy, reproduction, sexual development, consent, bodily autonomy and healthy relationships, abstinence and other methods for preventing unintended pregnancy and sexually transmitted infections, the relationship between substance abuse and sexual behavior and health, and consent as used in this section means affirmative, conscious, and voluntary agreement to engage in interpersonal, physical, or sexual activity as well. And I neglected to mention, including relationships involving diverse sexual orientations and gender identities. We've heard from testimony that all of these pieces are important and that they aren't being consistently delivered as well. On the subdivision 2, as it speaks more, the sexual health education program must include instruction on topics listed in subdivision 1 and must respect community values and respond to culturally diverse individuals and families. This was raised, and there's no doubt that this is difficult territory, that this is difficult content. And it's here that religious beliefs and cultural beliefs interact with this content. It doesn't mean that it should be, in my view, that we should be avoiding that. We need to find ways to both put forward information that's accurate, that's going to be providing the best outcomes for our youth, and then having conversations with members of our community about their beliefs, sharing both the content of the material and hearing where they're coming from. So no, in the context of our congregation, we have these conversations as this curriculum begins. We're very honest about what is going to be taught. And over time, more and more parents are comfortable with this and want this instruction for their youth. And then finally, we spoke some about some of the pieces on the rest, in the rest of subdivision 2. And subdivision 3 is the opt-out statute that does allow parents to opt out of curriculum that they don't feel like is a good fit for their student. And then the final section, section 2, is a report asking the Commissioner of Education to essentially report on how this is going, how many schools are participating, and what the experience has been.
Thank you, Representative Lippert. And I wanted to point out, the page did hand out the 2 letters you brought from St. James Independent School District in support and the Minnesota School-Based Health Alliance. So I just want to thank you, Representative Lippert, for bringing this bill forward. You heard from a lot of our testifiers here, from students to doctors and experts in the field, that students hunger for medically accurate, age-appropriate knowledge that's inclusive and helps them make safe and healthy decisions. I know that a lot of folks here have strong feelings around this topic area and this subject, but I want us to have a respectful conversation at the table. And if I feel like we're veering from that respectful conversation, I will do a course correction. So I just wanted to put that out there right now before we start discussing. So with that, Representative Erdahl, you had a question.
Thank you, Madam Chair. I have 2 questions, one for Representative Lippert and one for a testifier. Representative Lippert, you intend this to be a new course created in the school, or would this be part of the health curriculum?
I would imagine this
Lippert?
being, thank you, Madam Chair, Representative. This would be integrated into the health curriculum as a model program.
Okay, thank you.
Follow-up, Representative Erdahl?
And then the lady who testified with Mincasa, would she come forward, please?
Please state your name again for the record and proceed with your question, Representative Erdahl.
Thank you, Madam Chair. Lindsay Bryce, I'm the Law and Policy Director at Mincasa. And just for your information, I also have one of our prevention staff with who I may pull in depending on what kinds of questions we end up with.
Representative Erdahl.
Okay, thank you. And, this is an area certainly that I have an interest in. And so I have a bill that strives to educate children about reporting sexual abuse. It's generically called Aaron's Law. And, I have, I don't know, second, third hand or whatever, been told that Mincasa opposes this piece of legislation. I'd like to know if that's true, and if it is, then we should have a conversation about it.
Let's have a
Hey,
conversation about it.
sorry, Representative Erdahl, so you're asking about another bill with this bill, but are you
Well,
just saying you
I'm-
want the discussion to see what this bill would do to
Yeah,
help
Madam
teach
Chair,
kids about
Madam Chair.
sexual abuse?
This certainly is related
Yeah.
to the topic that we're
Oh,
we
it
are
definitely is.
considering.
I just wanted
And
to
I
make
don't
the
want
correction.
now to have the conversation with her. All I want to know is if they have expressed opposition to this bill, then perhaps in my office we could have a discussion.
Representative Erdahl, I'll give you some latitude on that. We were actually on Representative Lippert's bill, which does also include things that would address Aaron's Law. So, Miss, I'm sorry, I forgot your
Bryce.
Bryce, if you would like to attempt to answer that briefly, because we're going to actually go back to this bill.
I appreciate that. I'm happy to have a conversation. Let's find a time to have that conversation.
That was
Thank you,
easy.
Representative Erdahl.
That's all I wanted.
Sounds good. Could have had that offline.
I will
That's okay.
make sure that before I leave, I'll drop a card off for you and we can connect.
Thank you, Ms. Bryce. Glad I could make that connection. All right. Representative Gruenhagen.
Well, thank you, Madam Chair. Representative Lippert, I have 2 questions too, okay? I think we all share the same concerns. Your testifiers, yourself, I know your intentions are good, okay? However, I find myself in agreement with some of the concerns that were raised by the Minnesota School Board Association. The other thing, my question, what I want to zero in on is medically accurate information, okay, in terms of sex education. And I'm old enough to remember when comprehensive sex education entered the public school. You can figure out the date. It's probably late 50s or early 60s. And there were all kinds of promises of what it would accomplish beneficially. Well, I would, one of the statistics I have here is from the Center for Disease Control, CDC. I think most of us are familiar with that. And they issued a report that in the United States of America, they estimated the total number of people, children or young people and adults in our country that have an STD is 110 million, okay? Now, we have about 330 million citizens of the state. That means that about one out of every 3 people in this country have an STD, okay? According to the Center for Disease Control. There's 20 million, the same report, 20 million new infections per year, and 50% of those infections are between 15 and 24, where we're having major mental health crisis. Costs this country and healthcare costs about $16 billion a year. Now, we've had comprehensive sex education in some form for the last 50 years. And it's supposed to be neutral or, I can't think of the term right now, without moral absolutes, I guess. I'll just use that term. So the point is, and by the way, in the late 50s, early 60s, you could count the number of STDs in this country on one hand. Today, it has exploded, and it's hard to keep count. And many of those STDs have become resistant to antibiotics. In other words, when you get them, you can't get rid of them, okay? So my point is, the last comment I'll make about that is that we know from research that children's brain development to weigh the consequences of their actions isn't fully developed until their 20s. So when we give them this so-called comprehensive sex ed, I think we're doing a disservice to them. So my question to you, Representative Lippert, is, when we look at the overwhelming, irrefutable evidence of the damage that comprehensive sex ed has done to our young people and to our population, and the whole idea of promiscuity in general, why would you continue to want to mandate this into the schools?
Madam Chair.
Yes, Representative Lippert.
Thank you, Madam Chair. Representative. I guess my question in response is why wouldn't we want to be moving towards an approach that is statistically showing us it has better outcomes than what we're doing now? That we are seeing regularly that abstinence-only approaches do not lead to the outcomes that we want. And a more comprehensive approach will reduce unintended pregnancies, reduce sexually transmitted diseases, and delay the onset of sexual behavior.
Thank you. Representative Bird, I'll follow up. Representative Grunig can follow up.
You're getting us confused here? No.
Yeah, you sit next to each other all the time.
Thank you, Madam Chair. I would say, my response would be this. The overwhelming, irrefutable, and what I would say is incriminating evidence shows that comprehensive sex ed has contributed to all the things that you've said. The evidence that is being supported from your perspective and from your testifiers is circumstantial evidence, okay? That evidence can be manipulated, all right? I look at 50 years of consequences. It's irrefutable of what's happened. We've got out-of-wedlock births, exploding STDs, mental illness among our young people. So I'd say just the opposite is true, and I believe the evidence I'm putting forth is irrefutable and overwhelming. My next question, Madam Chair, whenever you come across a educational program, it's good to look at the history of that program and how did it start. Again, I'm old enough to remember when comprehensive sex ed entered the public school system, okay? And here are the authors of it. It's Dr. Alfred pervert and pedophile Kinsey. He did the male-female report, and he took illegal, unhealthy, and perverted sexual behaviors and tried to normalize them through research. And he did experiments on children under 5 years old. He should have been arrested and thrown in prison. Some of you may not have heard of Dr. Alfred Kinsey, but one of his fanatical disciples was Hugh Hefner, okay? A supporter of comprehensive sex ed. And I know we all heard of Hugh Hefner. So comprehensive sex ed origins were by Dr. Alfred Kinsey research and his fanatical disciple Hugh Hefner. And of course, we know that Planned Parenthood supports comprehensive sex education, and we know where they make their money. So my question to you is, do you understand the roots of comprehensive sex ed? Who instigated the fraudulent research of Dr. Alfred Kinsey, and how we're actually perverting our young people rather than helping them?
Representative Grunhagen, we're coming up on one of those course corrections. So can you please be careful with your words?
All right. Where we're actually promoting a not unmedical and disease-filled philosophy to our children rather than telling them straightforward what the truth actually is.
All right, Representative Lippert, I'll let you answer. Then also, I think maybe Dr. Chasin might have some comments to add. We heard a lot of odd statistics. So Representative Lippert.
Thank you, Madam Chair. Representative, I would begin by saying that I think that what is healthy in our culture related to sexuality and what is not is very complex. And I would suggest more complex than what you're suggesting. You asked about medically accurate a little earlier. So comprehensive sex ed curricula is going to be medically accurate if that information is verified by agencies like the Center for Disease Control, American Public Health Association, American Academy of Pediatrics, American College of Obstetricians and Gynecologists. So it's going to be rooted in peer-reviewed research. So that's a starting point for this curriculum.
Thank you, Representative Lippert. And I didn't know if anybody had something else to add, because I think that was a very comprehensive answer. Could you please state your name for the record and proceed?
Good morning. I'm Jenny Oliphant. I wanted to address two different points here. First of all, I wanted to bring up a major report by the Federal Department of Health and Human Services called The Impacts of 4 Title V, Section 510 Abstinence Education Programs in their final report. I just want to read the quote from this final report. It says, findings indicate that youth in abstinence-only programs, in the abstinence-only program group were no more likely than control group youth to have abstained from sex. And among those who reported having had sex, they had similar numbers of sexual partners and had not initiated sex at the same mean age, meaning that the abstinence-only till marriage type of curriculum or abstinence-only in and of itself does not have the same comprehensive effect as comprehensive sexual health education. I also wanted to bring forth that in my role as an expert in sexual health education, I am a federal reviewer for curriculum. In that role, I just want to explain how these curricula come to be medically accurate, because multiple reviewers are required to review curricula that end up on the federal list to be used. These curricula are looked through word by word, page by page, video by video for their medical accuracy. We must then report any inaccuracies or accuracies that need correction or slight changes. They must be supported by data that are approved in the sense that they would be peer-reviewed type of materials that you would find on the Centers for Disease Control or other kinds of websites or in the literature. It's a very strict criteria that those are approved through, and they're done by multiple reviewers. So there's checks and balances on this as well, and always by a peer-reviewed type of material.
Thank you. Representative Grunhagen, you had one follow-up, and then the chair is
Yeah,
going to
just
have
a
a
comment.
prerogative to ask.
I know other people have questions. You know, if you do your research on Dr. Alfred Kinsey, one of the first educational institutions to become one of their fanatical disciples was the University of Minnesota. sexual department. So I think her perspective is a little bit off because of the indoctrination she's received in her education. Thank
Representative
you.
Gruenhagen, thank you. We're done with that. I don't know if you want to, you've been referenced again. I don't know if you want to respond or we could just leave it. It's up to you. Ms. Oliphant.
I have no indoctrination.
Thank you, Ms. Oliphant. All right, we'll go on to the next question. Representative Hewitt.
Representative Gruenhagen's a hard act to follow here, Chair. I'm sorry. So, actually, I would like the physician from Dr. Smiley's clinic and possibly the researcher to come down, please, Madam Chair. Madam Chair, I'd like to thank both the testifiers here and Representative Lippert for helping us with this on modeling these kind of programs. The doctor from you work at Dr. Smiley's clinic, is that correct? I'm sorry, is it?
Smiley's clinic.
Smiley's clinic, yeah. I go back by dating myself by saying that. And I want to thank you for working there, that clinic. A lot of patients can't go there without physicians like you that dedicate their time, and I'm very familiar with the clinic. The clinic does have a large amount of mental health patients, is that correct, Doctor?
Dr. Chason?
Yeah, and I'm Nicole Chason again. Yeah. Thank you, Chairwoman. We're a primary care clinic, so we see the whole spectrum of primary care. So mental health is part of what we see in primary care. I don't think we have a larger proportion than any other primary care clinic.
Okay.
Representative Hewitt.
Thank you, Madam Chair. And I'm probably reaching here then, I'm just using you for an example of a population base that I'm going to ask the next question, and the researcher may be able to help on this too. Because we're trying to wrap our fingers around our mental health crisis in the schools too. And my question is, in your experience as practitioners and researchers, would you say it would be a fair statement, or maybe you can elaborate a little bit more, that individuals that have had a bad sexual experience in their adolescence or in their high school years actually end up with following up with mental health therapy for quite a long time after that? Would that be a fair statement, or would you be able to add to that at all?
Dr. Chason.
Thank you, Madam Chair. I would say that is wrapped into a whole host of experiences that can lead to, I'm trying to think of how to answer that question exactly. I think adverse experiences play into how people develop and how their mental health will potentially develop. I wouldn't say that everyone who's had an adverse experience will develop long-standing mental health issues. And given correct support and encouragement and education can actually benefit people and help with actually encourage resilience in those individuals. So I guess I'm trying to figure out what you're getting at with your question, but I would say yes, adverse experiences of many sorts can play into mental health outcomes. It would be normal to respond initially with some sort of reaction emotionally, but that does not necessarily mean you will have lifelong mental illness.
Madam Chair, and what I'm trying to get at here is that we're trying to do everything we can for the mental health crisis in the schools. We're lost. We are totally lost with this to try to get there.
Right.
And if this is one of the avenues, if we can find programs such as this that would be positive, that we can cut down on one area even that could benefit, is this one of those areas maybe?
Dr. Chason or Ms. Oliphant? Either one.
I don't know if you have anything you want to add. I would say that these are kind of two separate issues. We definitely see mental health issues in youth and mental health issues that extend into adulthood. This is a piece of education and a baseline that would be helpful in creating healthy bodies and healthy selves as they go into their healthy adult life. So sure, it would play into hopefully better mental health outcomes in the long run, but I think those are two separate issues that need to be addressed. Comprehensive sex education has its own benefits. Supporting supporting better access to mental health in schools is its own separate issue. So I wouldn't want to necessarily link them both together, but they certainly probably is a Venn diagram there somewhere.
Madam Chair, that's.
Do you have anything else?
Thank you, Mr. Representative Hewitt. I was just looking at those two to call on next. Thank you. Representative Erickson.
Thank you, Madam Chair. First, a comment about the SHAPE standards. Those are physical education standards adopted in 2017. They're national, and they include health in them. That's why the School Boards Association was citing those standards. The state does not dictate curriculum. We will, in the academic areas of math and reading and language arts, because it's a federal mandate, create standards and assessments to support those, but curriculum is always locally decided. But Madam Chair, I actually want to ask Representative Lippert about the bill. I think we should focus on the language in the bill because that is what we're here to do, is to debate what is in the bill, not get off on tangents. So Representative Lippert, on the word consent on line .121, can you define what you mean by interpersonal? And then please distinguish between physical and sexual activity.
Representative Lippert.
So, thank you, Madam Chair, Representative. Interpersonal is whenever two people are in relationship, is how I would read that. And physical could be what one testifier, the young person, talked about, violation of consent in a physical relationship that's not sexual would be, one example might be a boyfriend who says, it's my right, I have the right to hold your hand. Well, no, you don't, because our bodies are our own, and we need to be in conversation about whether that holding hands is mutual. And then sexual activity would be physical steps of intimacy beyond that.
Thank you,
Madam Chair.
Representative Erickson.
Thank you, Madam Chair. Representative Lippert, so in 609, we have a definition, that's a state chapter of law, a definition of consent. How does your proposed definition differ from that? Because 609 deals with sexual harassment and violence, and particularly our post-secondary institutions are supposed to follow that. Would you please comment on how your consent differs from that?
I don't have that state statute in front of me, Madam Chair, Representative.
Thank you, Representative Lippert. I'm just pulling it up right now to see what it says. Actually, excuse me. Oh, actually, I'm hearing phone a friend. Can Ms. Bryce come down and give us some enlightenment? I think you have some expertise on Chapter 609.
Can, except I probably need the language in front of me as well.
Okay, here, I will lend you the book. It's not
Madam Chair, I can read it.
Oh, I just wanted to make sure she was looking at what you were looking at, Representative Erickson.
Madam Chair, Representative, can you tell me what statute exactly you're looking at?
Well, I'm referring to 609, where there's a definition of consent, and then in 135A.15, sexual harassment and violence policy cross-references consent. So I'm just wondering of the representative, not of you, of the representative, how this differs in his language in the bill. Because he wrote the bill, so I want to know, how is this different?
Representative Christensen, I believe we always allow authors to rely on experts when they testify. So Representative Lippert, would you like Ms. Bryce to help you answer?
Yes, I would, Madam Chair.
Thank you, Representative Lippert. Ms. Bryce, continue, please.
So 609.341 sub 4 gives the definition, is the definition of consent in the criminal chapter. And that is what we use throughout our criminal prosecutions. And that's what law enforcement uses when they're investigating a case. That's what prosecution uses when they are looking at whether or not something is a prosecutable offense, and I'll read that to you. Consent, subdivision 4, consent. A, consent means words or overt actions by a person indicating a freely given present agreement to perform a particular sexual act with the actor. Consent does not mean the existence of a prior or current social relationship between the actor and the complainant, or that the complainant failed to resist a particular sexual act. And then there's subdivision B and C. C is about corroboration, which is really just about a criminal case. But B specifically talks about how a person who is mentally incapacitated or physically helpless, as defined later in the subdivision in the section, cannot consent to a sexual act. So that is the definition of consent that's used in a criminal case, and is really about whether or not to bring criminal charges.
So, Madam Chair.
Representative Erickson, follow up.
So, Representative Lippert, would that be something that you would expect to be taught in this model program?
Representative Lippert.
Madam Chair, thank you. Thank you, Representative. I think the language here speaks of affirmative, conscious, and voluntary agreement. I think it may well be appropriate to talk about the boundaries of where there are legal consequences, and that would be a topic that would be discussed. But there's much more important territory to cover as well, to make sure that in developing skill building around consent, the young people know that their bodies are their own, and they have the self-worth to understand that they can say no to sexual advances that they do not want, and also to be building and nurturing a value of mutual respect, so that in every interaction increasingly, they're honoring the bodies of those that they're in relationship with. As we can be instilling this sort of culture of consent and this sort of skill building in relation to consent with our youth, we will have better outcomes, healthier relationships, less violence in relationship too.
So, Madam Chair.
Thank you, Representative Erickson, follow up.
So, Representative Lippert, you're expecting our children then will be having sex at early ages, is that correct?
Representative Lippert.
Madam Chair, Representative, I'm not quite sure how those two questions come together, but
Consent.
so I think we all understand the reality of that we are sexual beings, and young people do engage in sexual relationships. I also think that we share the concern of risky sexual behavior and sexual behavior that's beginning too young, too early, that we want our youth to be safe and healthy. And so any program and curriculum that's helping youth delay the onset of sexual behavior is a good. Any program that's reducing unwanted pregnancies is a good, and preventing the transmission of sexually transmitted diseases is good too.
Madam Chair.
Representative Erickson, I have a few other questions too. Do you have one more follow-up on just this, and then the
Madam
next
Chair,
questions to
I would
that
like to
topic?
continue, thank you. In lines 2.21 and some of the other 2.19, you're asking that a school district or a charter submit for approval the sexual health education program that they don't adopt. So where else in statute do we mandate that if there's not a following of this model, we have to be telling the department, we have to submit written materials, we have to describe the training? I mean, why are we doing this to our local school districts?
Representative Lippert.
Thank you, Madam Chair and Representative. So it's my understanding that schools do need to provide health education. And this would be a model program for a more comprehensive approach to sexual health education, that dimension of it. And so if this model isn't being adopted, the school districts simply need to communicate what they're doing.
Thank you, Representative Lippert.
Yeah.
Representative Erickson?
Well, Madam Chair, and it has to be approved. Representative Lippert, it has to be approved as well. I mean, are we dictating now to our local school districts and totally taking local control away from them? I mean, I hope you think carefully about this as you move forward, because this is a huge mandate and an intrusion into what different communities and different school districts value for their children. These are our children.
Representative Lippert.
Madam Chair, thank you, Representative. This is a model. School districts will still have flexibility in what is the best fit for their district. And it will simply be a new resource that's available that will serve the health and safety of our youth.
Representative Moeller.
Thank you, Madam Chair, and thank you so much for bringing this bill, and also thank you to the testifiers. I want to talk some more about the consent issue. So we in the Public Safety Divisions, there are several of us that are on that committee, and we've been talking a lot about sexual assault and what happens as a result of sexual assault, and are we holding offenders accountable, which is extremely important work. But part of that equation is also, what are we doing to prevent sexual assault? Prevention is key, and I heard that from a couple of the testifiers. I know Mincasa's been working for years on prevention programs. And I just wanted to let the committee know about, and anybody listening, there was a really good article in Time Magazine on January 15th. And the author of that article had also written a book called Speak, and it's about a teenage girl who is struggling through the emotional aftermath of being raped. And this book is a book that I think is used, according to the author, in some high school and college curriculums. And that author, Lori Anderson, says that she's been visiting schools and talking with students for over 20 years. And she says that in schools all over the country, in every demographic group imaginable for 20 years, teenage boys have told me the same thing about the rape victim in Speak. They don't believe that she was actually raped. They argue that she drank beer, she danced with her attacker, and therefore she wanted sex. They see his violence as a reasonable outcome. Many of them have clearly been in the same situation. She said there are also boys that she'll talk to who have empathy for girls that they know who have been victimized. She's talked to both girls and boys who will come up to her after their presentation who are survivors of sexual assault. And she said that the empathetic boys searching for ways to help survivors and the boys who believe that rape only counts if it is committed by an armed stranger have more in common than you'd think. They struggle in the absence of information. They are looking for leadership and models of behavior. They share a desire to learn more. Teenage boys are hungry for practical conversations about sex. They want to know the rules. They want to be the good guy, the stand-up, honorable dude. Their intentions might be good, but their ignorance is dangerous. Our society has begun talking a bit more openly about these issues, but that doesn't mean teenage boys suddenly have all the information they need. And I guess I wanted to call down Grace, was it Mortensen? If you could come back down, please. My question is for you.
Ms. Mortensen, state your name for the record again.
Grace Mortensen.
Thank you, Representative Moeller.
Yeah, thank you. And so I just wanted to, I know you talked about the student survey and students having a desire to know more about consent. And I would like you to speak a little bit more about that, please.
Yeah. Ms. Mortensen.
Thank you. So in terms of the conversations that some people requested in having consent, it does touch on this bill in terms of starting these conversations at younger ages. I have maybe another quote I didn't mention before in front of me. 1 second while I just collect that. So One person said that they would recommend tiered education that is age appropriate and builds on itself as student age. Examples being appropriate physical touching for fourth graders versus anatomy for eighth graders, going on and on. So I think what young people acknowledge is the fact that talking about like elementary and secondary education and consent education starting at that age, it isn't about sexual touch all of the time. In response to your question, is that making young people have sex sooner? This is in regards to physical touch, in terms of are they comfortable being hugged, identifying good touch and bad touch, as was identified earlier, and being able to empower young people with the bodily autonomy to be able to make those statements for themselves. Because young people being touched inappropriately don't always understand that they have the power to say no. There are power dynamics, like we were talking about earlier in that bill proposed with teachers and students, that disallow young people from being able to make the decisions that are about their own bodies and being able to say yes, say no. And even in the situations where they can't say yes or no because of the circumstances surrounding them. So I believe that the young people today want to have consent incorporated from a younger age and incorporated into each aspect of their education, talking about bodily autonomy being younger, talking about anatomy and touch as growing older. I do agree with you as well that I've spoken with people who have not understood with the fact that have told stories, told anecdotes, and not understood what they did was assault, what they did was harassment, because they were never given the frame. Because under this context, they were in a relationship, they were drunk, they didn't say no, but they didn't say yes, and we were already kind of going there. So why not just keep going? So what young people want is to be able to understand and to make clear to all parties that are involved in these relationships, whether they be physical, with friendships, sexual, and relationships, that people have autonomy, people have a voice, and that consent makes a difference. In relationships that are heterosexual, with gay relationships, lesbian relationships, all of these people have voices that need to be heard. And by starting this foundation sooner, we can really kind of create an atmosphere and an environment, like you said, that fosters loving each other and loving our bodies and respecting each other.
Thank you, Ms. Martinson.
Yeah.
Representative Mueller, follow up.
Yep, thank you. And so I think you mentioned this already, but we did hear from one of the other testifiers about like good touch, bad touch curriculum in kindergarten, and that is being taught now. And I actually volunteered and taught a curriculum like that through a nonprofit when I was in college. So this issue is really important to me. We need to really be teaching our young people about consent and what that means from an early age, but not just in a sexual connotation. So thank you very much.
I believe it's not always sexual.
Thank you, Ms. Martin.
Thank you.
I have next on the list Representative Bierman.
Thank you, Madam Chair. Representative Lippert, I just wanted to follow up on the question on the local control. It was determined that with this curriculum, it will be well publicized. Any parents can review it. Any parent can completely opt out of it if they choose, correct?
Representative Lippert.
Madam Chair, thank you, Representative. Yes, that's correct.
Okay, and then one of the earlier, Madam Chair, thank you. One of the earlier speakers mentioned that under 2.28 to 2.32, there's the question about who's teaching and what their employability would be. This is no different than what our current teacher status with Tier 1 to Tier 4. Administrators are able to hire outside people to come in and instruct without a teaching licensure right now. That's what I understand. Is that correct?
Representative Bierman, I think he's talking more about like community experts under
Community
this
experts.
language. Yes.
Okay,
thank you.
so
more
that-
than the licensure issues. So community experts.
So they may not have a teacher license, but they are still can come into the schools and do a program like this. So
Representative Lippert.
that's not a change.
Thank you, Madam Chair. Representative Bierman. I think part of what's important in a comprehensive sexual health curriculum is some training. is some expertise. And the willingness and ability to discuss difficult topics and difficult content matter with young people, and to do that well, to be prepared to do that. And so making sure that that training is in place and drawing on teachers who have that training will be particularly important.
Okay.
Thank you,
All
Representative
right.
Lippert. Representative
May I have
Bureau,
another question?
follow-up?
Actually, this is more like a statement. It's not a question. I just wanted to thank you for bringing the bill forward. I think so much of this connects. When I got onto this policy committee, I was very excited because the education policy was something that I really, really wanted to work on when I came here. And we've gone into things like with Representative Hare's bill on personal finance. We've gone into Representative Erdahl's bill on civics. And these are, two areas that I know from my own experience with my own kids. There's areas that I think our schools can do better. We ask our schools to do so much that they are integral, and education changes, and the needs of the kids change as society changes. So it is a constant evolving process. But the constants have to be outcomes, and personal health care, sexual health care for our kids, and education. I mean, more knowledge is better, and knowledge is freedom, and that's what our education system needs to focus on. So I applaud you for bringing this forward, having this good conversation, and I just think it's also important that we focus on the year 2019. That's where we are today. We've been other places, and you can bring up many claims and counterclaims about where we came from, but we need to focus on the now, and we need to focus on facts and legitimacy of knowledge and teaching and scientific basis. My kids, they learned a lot of things about math and literacy, and we test on those things in science, and we rely on that. But I don't go to the school and I trust the schools to a great degree, and I want to know what they're doing and what they're learning. But I also want to make sure it's comprehensive, and clearly our sex ed is not comprehensive by a long way. It's as if we're teaching math and we're teaching addition and subtraction, but not getting into division. And I think comprehensive healthcare sex ed is important, as Representative Hewitt mentioned when he talked about this connection about healthcare with all the other things about personal health and what kids are going through. Everything's connected. So I applaud you for bringing the bill forward, and I know that we can do a lot better in our sex ed, and we're going to have better outcomes for some of the things we're looking for. So appreciate it.
Thank you. Representative Scott.
Thank you, Madam Chair, and I do have a few questions here. To the bill's author, I'm just wondering if you drafted this bill, if you had help drafting this bill or input, just kind of wondering about the origins of it.
Representative Scott, we usually don't ask, well, I suppose we can ask about intent a little bit, but Representative Lippert, do you want to answer that?
Thank you, Madam Chair. Representative, as with most bills, this bill is a team approach. And so the lead authors on the bill, we're all working, or the authors on the bill, we're all working together on this legislation, and I'm in the lead. And that's not unusual in my experience in the legislature these last few weeks.
Thank you, Representative Lippert. Representative Scott, follow up?
Thank you, Madam Chair. And it's been brought up by several of the testifiers, and the bill has some language regarding a community organization that can provide instructions. And I'm just wondering if Planned Parenthood would qualify.
Representative Lippert.
Thank you, Madam Chair. Representative, what we're asking the Commissioner of Education to do is to draw on model curricula that are out there. And there are a variety of good curricula that have various starting points, including some mentioned today from the faith community. Planned Parenthood is an organization that does have concerns and expertise in the area of sexual health, and will be a part of that conversation. But we're asking the Commissioner of Education to come up with a model program.
Representative Scott.
So thank you. So the answer is yes, they would be a potential community organization that would qualify to present in a classroom, for instance.
Representative Lippert.
Thank you, Madam Chair. Representative. So Planned Parenthood is an organization that does work in this area, a curriculum in the area of sexual health. A curriculum is going to be a self-contained program.
Representative Lippert, since I'm going to pitch it here as one of your 5 co-authors, and we also had Dr. Elise Mann, or Representative Elise Mann, Representative Kelly Morrison, myself, and Representative Kanish Podine worked on this very closely together, and this still gives school districts local autonomy to decide who they want to have come in and teach us. So whatever the standard is now will still be the standard.
Okay, thank you, Madam Chair. And one of the questions that Representative Dearman?
Representative Scott, I want to make sure, I forgot to mention this, Representative Kanish Podine just got a text, both Representative Lippert, I need you to go into the mic a little bit, and we have to make sure we're not turning our heads. There's people streaming it that are having a hard time hearing everybody's questions, so thank you, Representative Scott.
Thank you, Madam Chair.
So I believe the prior representative asked the question that regarding would parents be able to see this curriculum and view it and so forth. And the bill's author responded that yes. And so I would like for the bill's author to point that out in the bill where that language is.
Representative Lippert.
Thank you, Madam Chair. Representative. So I read that in subdivision 2, numbers 1 and 2. So respecting community values and responding to culturally diverse families, individuals, families, and communities in an inclusive, respectful, and effective manner, I believe requires communication about the content of curriculum so that families know what they're getting into.
Representative Scott, I believe also what you're looking for is on line 3.1 to 3.3.
Okay, thank you.
Parental review.
The next question I have is, would you be open to an amendment when this gets to the floor that says that there must be a public meeting or a public hearing with parents before a school would adopt any curriculum?
Representative Lippert.
Madam Chair, Representative, I think that pushes against the idea of local control. I think we should be able to trust the school districts to determine the best ways to be communicating with their students and families about this information, this curriculum.
Representative Scott, one more follow-up. We've got some.
I've got more follow-up, Madam Chair. I'm not done. We've spent an hour and a half on the other side.
Representative Scott, we're going to be respectful in this committee, and I know people also want to get lunch. We are planning on talking to this bill until 1. We have been on it since 10:20. I have other people on the list, so please, let's keep respectful.
I'm being respectful, Madam Chair, and we've spent a lot of time on this bill. The legislators we spent a lot of time on testimony. Legislators are here to drill down on legislation. That's our job. So I have a few more questions. To the representative, to the bill's author, one of the things that you stated was that consent protects the safety of all genders. And I had a mom in my office this week, and she left me this pamphlet, and I can make copies for people if they're interested. But her son was falsely accused and this was a college setting, but this could easily happen in a high school or even younger setting, I suppose now. But her son was falsely accused, and later, and the college, by the way, had this affirmative consent language, and he was falsely accused. He was later exonerated after $150,000 in legal bills. And, but if you, now when her son goes to apply for any job, even though he's been exonerated, when you go on the internet, it pops up that he was, he was accused of this and that there was a court case and so forth. And so it's prevented him from getting any jobs. And so I'm a mom of a son. Thankful he's married now. And I obviously have a husband. And my concern with any parent that has a young boy especially is that this consent language, which is now, this affirmative consent language, is now being tested in court, and it's found to be too vague because you'd almost have to have an actual videotape to prove that someone did or did not give affirmative consent. And so I noticed that you have language about that in the bill, and I understand, our bodies are our own. I get all that. But I want to know what you're going to do to protect both genders when it's a he said, she said situation.
Representative Lippert.
Thank you, Madam Chair.
How would this curriculum do that?
Thank you, Representative. I think the example you bring forward points to how we need to equip our young people with skills to allow them to get better at navigating consent in the midst of relationship. We need to help our youth develop these skills. And so I think the starting point is encouraging young people to be communicating about their sexual decisions. So I think that's the beginning.
I think we have some folks that have posted a testifier table that may want to add something. Could you please state your name to the record, for the record, please?
My name is Grace Muth. I'm not an expert in any of this. Well, I guess in a way I am. I'm a young person, and we understand consent, and we understand having an honor system with consent. So if it's explicit, if it's clear, then people respect that. Once they know, yes, this was consensual, yes, this was okay. And when it gets to he said, she said business, if it's clear to both sides that it was or wasn't consensual, then there isn't an issue. And so I guess what I'm trying to say is if we can teach it in a better way, then it cuts down on it being as big of an issue between the sides. That makes sense.
Thank you. Yes, thank you. I think what you're trying to say is if people understand what it is, maybe there won't end up being a he said, she said issue. Thank you. Thank you for testifying. Representative Scott.
And Madam Chair, and I understand that, but we all know of times in our own experience where we've been hurt by a relationship. Somebody breaks up with somebody else. And some of these issues, some of these cases have come up after the fact because in a retaliatory way, even if there was consent originally given, then the person that supposedly gave consent comes back and said that they did not provide consent, and then we're in a big mess. And so that's my concern with this affirmative consent. I don't know if there's a way to really craft it so it gets at what you're getting at, but I just want people to acknowledge that there are two sides to this. And the other question I have and this will be my last question, for the author is on lines 1.15 and 1.16. 1.15 uses a term called human anatomy, and then on 1.16, there's a word called bodily anatomy, and I'd like to know what the difference is. Oh, bodily autonomy. I'm sorry, I misread that. Scratch the question.
Okay. Thank you, Representative Scott.
Madam Chair, there's one more response to Representative Scott.
Okay, could you state your name for the record, please, again?
Thank you, Madam Chair, Committee. My name is Lindsay Bryce, and I'm from the Minnesota Coalition Against Sexual Assault. I just wanted to talk about the question that you asked, because am I close enough to the mic, or we having
Yep,
issues?
you're fine.
Okay. Because I think it does get confusing. In fact, what I heard you saying is you were talking about affirmative consent within the context of a school and a school a school guideline or a school handbook talking about affirmative consent, and somebody going through being accused of something that violated that school guideline, which would be going through a Title IX process, which is a civil process that can also end up in court, but it's a civil and it's a very different process than the criminal justice system. Then there's the criminal justice system process where someone is accused of a crime and they're charged with a crime, and that's the definition I had read earlier from 609.341. That's Minnesota's definition of consent that's used in the criminal system. But when you're talking about affirmative consent, that is not what is used in the criminal system. That is used in, you're right, in a number of different schools. And so when someone is accused, so there sometimes can be two completely separate processes going on when somebody is accused of a sexual assault of some kind. If it's, an example would be at, let's say one of our local colleges, one student is accused of assaulting another student, and there is, and that school has adopted affirmative consent. They're going to go through their process, their campus process, and the most significant penalty, legal penalty in their process is essentially not being able to attend that school, getting kicked out of that school. When you're looking at the criminal process, the most significant penalty there is obviously being put in jail or in prison, and it's really about that is sort of the peak of the potential consequences. So I guess I'm explaining this because I think it's important to realize that the consent language in this bill doesn't need to exactly follow the criminal process, because that isn't what we're talking about. We're talking about a school situation where a school can have rules and guidelines around what is appropriate and what is not appropriate behavior for a student. Their handbook, for example.
Thank you, Ms. Rice. So you're talking more, that's even separate from this bill. This bill is just teaching kids.
Exactly.
What we're already, expounding out what we're already teaching them in kindergarten with good touch, bad touch, your body's your own. If a school chooses to make a handbook, that's separate from anything we're doing here. Ms. Rice?
Absolutely. I just think that when we start talking about things like affirmative consent in schools, we end up conflating criminal process, a Title IX process within a school, and then we're talking about something completely separate, which is the education piece that comes prior to all of that.
Thank you, Ms. Bryce. I just didn't want to get.
Thank you.
I haven't had enough coffee. I'm on like 4 hours of sleep after last night. So Representative Scott, did you have a follow-up?
Nope, I'm good.
Thank you. We have about five more people on the list, and then we have a few amendments, and then I know we're going to break for lunch. So the folks I'm going to call, if you can be a little brief, and then we will move to amendments. Thank you. Representative Wozlovic.
Thank you, Madam Chair. My questions have been addressed, so I will.
Thank you. Representative Hassan.
Thank you, Madam Chair. I don't have a question. I just have a comment. I want to thank Representative Lippert for bringing this bill forward. I just want to remind people that there's data out there that says 1 in 5 girls and 1 in 20 boys are victims of sexual assault. And when you look at data like that, you think about what are we doing wrong that we're not teaching our, kids to speak up when somebody touches them inappropriately or when someone does something wrong. Well, we do not have comprehensive sex ed. Representative Gruenhagen said we do since in the 60s. No, we don't. I went to school in this country, and we do not have a comprehensive sex ed. As an adult, after college, I had to learn what comprehensive sex ed means. And I have a 15-year-old son, and I'm teaching him consent, and I'm teaching him how to speak up when somebody does something that's inappropriate, what healthy relationship looks like. We don't teach our kids what healthy relationship looks like. All kids are just picking up behaviors from the internet, and what changed since the 60s is technology and internet. You Google the word sex on the internet, and you have millions and millions of websites that came up, and most of them are inappropriate websites. It's not sex education websites. So I just want to highlight that the rape culture of our country has gotten so bad that there's a hashtag movement that says #MeToo started because people, especially women, got tired of keeping silent. So if we're teaching kids, this is what comprehensive sex ed looks like. And science has, proven that when we talk about sex and teach kids about sex and they teach them about their body, they're not going to engage in risk behaviors. They're not going to engage sex early. The worst fear for parents is that, oh yeah, more kids are gonna have sex. No, actually, it's the opposite. When they know about it, they're gonna make an actual rational decision about it. And you're right, kids' brains are not developed until 25. So the more comprehensive sex ed and guidance we can give them, the more responsible adults that they're going to be turning out to be. So thank you very much. I don't have a question.
Madam Chair, my name was mentioned.
Representative Gruenhagen, your name wasn't mentioned. We were just talking about testimony.
No,
Or did we? Did you mention his
He
name?
did mention my
Oh,
name.
then, yep, I'm sorry. I clearly am too tired. So Representative Gruenhagen.
Real quick.
Thank you, Representative Bertle.
Hey, I understand where she's coming from, and I just respectfully disagree with some of her conclusions, but I can tell her heart's in the right place. But I will say one positive thing about the Me Too movement. Young girls in this country are at least getting a good sex education on what really goes out there in the culture versus the comprehensive sex ed message they're getting in our schools. Thank you, Madam Chair.
Representative Gruenhagen, thank you. Representative Christensen.
I withdraw my question. Thank you.
Okay. Representative Herr.
I'll try to make this really quick. So, and then actually Ms. Bryce answered some of the questions because I was just wondering, I think that as we live as human beings, we often strive to not just live by the letter of the law, but the spirit of the law. And so though the law tells me that I shouldn't kill people or slander or do really awful things, I try to live above that by being kind and giving and loving. And so I think this conversation we're having about criminal and what we're doing here, I feel like this work is trying to speak to the spirit of what we're trying to do so that people don't end up having to look at the language in the criminal definitions. And so I appreciate some of that information. I did just have a quick question, though, around the standard and the flexibility within this program. And I'm going to tell a little bit of a story because I think I've heard a lot of storytelling in here. And I just wanted to share that I have two girls, and from the minute they could talk, so my first one started speaking at 9 months old. So we began talking about appropriate touch by the time she was 18 months because she could speak in 3-4-word sentences by then already. And they were all, by the time she was 2, she was potty trained and using anatomically correct names for her body parts and identifying other people's body parts and things like that. And so, and we talked about sex and identity and their bodies, and they are not sexually promiscuous today. They're 19 and 15. And so I don't think that the talking of it and teaching of it leads to sexual promiscuity. And so, but I do want to, because I did hear that some of this education talking leads to that. So I just wanted to make sure that to say that my own lived experience does not show that. But I do come from a culture and a religion that is very strict. I grew up in a culture that taught me certain things about my own body that were incorrect or what I should do with my body. And I grew up in a very religious household. My parents were pastors. My grandfather's a pastor, and I love them to death. But they taught me very, their beliefs around sexuality and body, and I respect that. And so, and that actually, I don't believe that what they've done is wrong. I think that they did what they knew was best. And I just was just wanting to make sure that in this particular bill here, there is a section here that talks about how school districts and charter schools that do not adopt the model program, that they have an ability to opt out. And I just wanted to make sure I was reading that correctly, that if, let's say, there's a certain institution that has very strong beliefs of certain things, if they can demonstrate the way they could teach some of these things that fall within their own belief systems, whether it's cultural or religious, that this does give them the option to do that. Is that correct?
Representative Lippert.
Thank you, Madam Chair. Thank you, Representative. That's my understanding, yes.
Thank you. Thank you, Representative Herr. Representative Kunesh-Podein.
Thank you, Madam Chair, and thank you, Representative. Thank you for bringing this bill forward. I'm a teacher, I'm a parent, and I really recognize the importance of laying a foundation of healthy relationships. myself have taught sex education to sixth graders, and the questions and the maturity that they always showed during those classes were really so valuable to myself and to the others. And if we think that teenagers or kids aren't having sex, then we are living with a hood over our head. One of the statistics I found is that roughly 46% of all high school students in the U.S. and 62% of seniors in high school are already having sex. Before I came to started my leave of absence to come to the legislature, I completed the purchase of new books and materials and educational materials for the middle school that I teach at. And right at the end there, a science teacher emailed me and said, could you please get us some books on sexuality, sex education, the human body, human development of sexuality. Because in her science class, when they were talking about genetics, the kids kept coming up with question after question after question about how their body works. Can you get pregnant on the very first time? All of these sort of things. And so as a teacher and as really involved people here and as legislators, we know that knowledge is power. And when we provide that kind of power to our students, to our children, to make the right decisions, to create healthy relationships, that creates a healthy community and a thriving community. So this kind of information, this kind of program that we make available in our schools is to help those students and those families who don't know how to address it, don't have the facts in front of them. And if we think that STDs have just started or are just ramping up now, I think there's reference in the Bible to sexually transmitted disease. So it's been around since the world has begun. And that's certainly something that we want to prevent as we see a rise in that arena as well. So I just want to make a statement, and I want to thank you for providing this legislation, because we really want to empower our students to create a healthy, safe relationships and build our healthy communities by addressing those issues. And part of that is consent. But it's also sexual assault prevention, and it's also giving us, or those students and us, the power to stand up when you see something is happening, something is not going on well. We have an obligation as parents, as community members, as teachers, as legislators, to ensure that our children, as well as adults, are safe in our communities. And this is one way to do it around well-established, scientifically approved curriculum within our schools. So thank you much.
Thank you, Representative Kunesh-Podein. And I know we've talked a little bit about brain development. I'm just going to geek out on stats here. I think a lot of folks know brain development is executive function, that frontal lobe where adults can make wise decisions. And you're right, it does not develop fully until you're like between 23 and 26. I know, because I have a 23, 22, and a 19-year-old. But what we do know also is that before the age of 5, a majority of that brain development does happen. So kids are able to then proceed and learn more and grow as they get to that full potential. Kind of think of it like, that last 20 pounds you can't quite get off. That's what happens between 5 and 23 to 26. So in that discussion here, I want to bring up the amendments. Representative Rudolph.
Real quick. Madam Chair, do you know how many legislators we have under the age of 26?
I believe we have 2? Yeah.
Okay.
I had to think there for a minute. I remember I said 23 to 26. So there's a variety. Some people could be excelled. Representative Gruenhagen, real quick, and then we're going to move to amendments.
Madam Chair, I know we had a streaming problem as far as the
Audio, yeah.
audio. So if you want me to repeat my testimony, I'm
Yeah,
more than
no,
happy
not
to
so
do
much. Okay. So I have 4 amendments in front of me. I don't know whose they are, so would anybody like to present any of them?
Madam Chair, I move the A4 amendment.
Representative Erickson moves the A4 amendment. Would you like to describe your amendment, Representative Erickson?
Madam Chair and Committee, the A4 amendment has to do with rulemaking. Looking at this proposal and seeing that it's broad, to me would send a message to the Commissioner that the rulemaking process should be used to become detailed and specific in this model program. I would also like to note that the inclusion of the subdivision 5 is that if, when these rules are announced to the public, that they be able to weigh in, and if 100 request a hearing, then subdivision 5 of 14.389 kicks in. So that's my amendment, Madam Chair.
Representative Lippert, your thoughts on the amendment?
Thank you, Madam Chair. Thank you, Representative. I'm open to that amendment.
All right, thank you. So any further discussion on the amendment? Those in favor say aye.
Aye.
Those opposed? No. The amendment, A4 amendment is adopted. And
Madam
there's
Chair, I'll offer the A6 amendment.
A6 amendment. Would you like Representative
Madam
Erickson
Chair,
offers the A6
the
amendment. Would you
A6
like to
amendment is
describe it,
added
please?
on page 1 after line 22 to note that the model program should include notification to students and school employees regarding criminal penalties for engaging in sexual contact with minors and the inavailability of mistake as to age or consent of the minor as a defense, and 2, that school employees and administrators, that a teacher or administrator who engages in sexual contact with a student may be found in violation of the teacher code of ethics, and that such conduct may be grounds for suspension or revocation of a teaching license in accordance with section 122A.20 sub 1, paragraph A, clause 1.
Representative Lippert, discussion on the amendment.
Thank you, Madam Chair. I'm open to this in principle, and I'm willing to work out the details as this legislation will move forward.
Thank you, Representative Lippert. Any further discussion on the amendment? Seeing none, all those in favor say aye.
Aye.
All those opposed say no. No. A6 amendment is adopted. 2 more amendments are before us. Who would like to offer them?
Madam Chair, I'll offer the A2 amendment.
Representative Erickson offers the A2 amendment. Representative Erickson, would you like to discuss your amendment?
This is page 2 after line 32, which is at the bottom of the page, to insert the requirements of this subdivision do not supersede local health standards developed in accordance with section 120B.021, sub 1, paragraph A, clause 6. If they are found to be inconsistent with local standards, the local standards must govern. I ask for your support.
Representative Lippert, your thoughts on the amendment?
Thank you, Madam Chair. I don't think this amendment is necessary. I think the district still has local control, and that this legislation won't affect that.
Thank you, Representative Lippert. Does that mean that you won't accept the amendment?
I won't accept the amendment, Madam Chair.
Thank you, Representative Lippert. Any further discussion on the amendment? Representative Gruenhagen.
Yeah, I mean, the bill uses the word must, and I think shall, and I think this amendment is very reasonable in terms if you believe in local control. So I would strongly urge support of this amendment, and I think it will improve the bill slightly, at least. Thank you.
Representative Erickson moves the A2 amendment. Seeing no further discussion, all those in favor say aye.
Aye.
All those opposed say no. No. The A2 amendment is not adopted. We have one more amendment before us. Who would like to present that?
Madam Chair, I'll offer the A1 amendment.
Representative Erickson moves the A1 amendment. Representative Erickson, go ahead and
Page 3
describe your amendment.
after line 3, insert a subdivision 4 that would read alternative school program. The requirements of sub 2 do not apply to a school district that has implemented a program in accordance with section 121A.23. And then line 8 before the period, also insert that statutory reference, 121A.23.
Representative Lippert, any thoughts on the amendment?
Madam Chair, I don't accept this amendment. I think I prefer the bill as is.
Thank you, Representative Lippert. Any further discussion on the amendment?
Madam Chair.
Yes, Representative Wozniak.
Thank you, Madam Chair. Representative Erickson, I'm wondering if she could provide us what that, just for the record, what that section describes, because it's a number. We don't really know what it actually means.
Thank you, Representative Erickson.
Well, this exempts schools from the program requirements if the school has a program already under 121A.23, prevent and reduce the risks of sexually transmitted infections and disease, which is in statute.
So thank you, Representative Erickson. Representative Wozniak, I think she just, the 1.121A.23, as Representative Erickson said, only talks about sexually transmitted diseases. Do you have a follow-up?
Yeah, no, just thank you, Madam Chair. I just wanted to clarify what that was and how that might be different than what we're actually looking at in the bill. Thank you.
Thank you so much, Representative Wozniak. Representative Lippert, any final word on the amendment?
I think this bill puts forward a more comprehensive approach than what is being suggested.
Thank you, Representative Lippert. Representative Erickson has moved the A1 amendment. Seeing no further discussion, all those in favor say aye.
Aye.
All those opposed say no. No. The A1 amendment is not adopted. I don't know if I see any further discussion at the table, so I would like to give Representative Lippert the final word.
Thank you, Madam Chair. I deeply appreciate the conversation we've had this morning and the testifiers. I'm the son of two teachers. I respect very much all that we ask schools to do, and think we need to be outcome-driven as we're thinking about this material. As testifiers shared, we have significant needs. We want to be moving towards increased health and safety of our youth. We should be following the outcomes that lead to less risky sexual behavior, building skills of consent, providing our youth deserve medically accurate information. So this program will be a great step forward for our students in our state, and I urge the committee to vote in approval. Thank you, Madam Chair.
Yeah, thank you, Representative Lippert. Actually, we're going to be laying the bill over, but Representative Lippert, I would like to renew my motion that House File 1414 be laid over for possible, as amended, be laid over for possible inclusion in the education policy bill.